everyone, my name is Whitney and I'm a registered dental hygienist, and today we're talking about something that doesn't seem to get enough attention in clinical care: collaboration. So we all know what it feels like to give patients the same oral hygiene instructions over and over and over and see little follow through. But what if the problem isn't what we're saying, it's how we're saying it? Being more collaborative with our patients can make a world of difference. It shifts the dynamic from lecturing to partnering. And when you do that, patients are far more likely to follow through. So here are 3 ways you can start being more collaborative with your patients. Number 1, meet them where they're at. The first and most important way to be more collaborative is to meet patients where they're at. Let's say a patient tells you they don't floss at all. Instead of jumping into a speech about how they should be flossing every day, try something like, okay, how about starting with 2 days a week? Just pick 2 days, any days. That sounds way more manageable and they're much more likely to commit to it. And once they succeed at that, it's easier to build up to more. Same goes for brushing habits and products. Maybe you know they'd benefit from switching to an electric toothbrush, but they love their manual toothbrush. That's okay. You can still help them get better results by teaching them the best brushing motions for a manual brush. You're still raising the standard. You're just doing it in a way that works with them, not against them. The point is, don't let perfect be the enemy of progress, right? Small wins build trust, and trust builds better habits over time. Number 2, focus on what they care about. So this second strategy of mine is to focus on what the patient actually cares about, even if it's not what you want them to care about. For instance, some patients light up when you talk about nutrition, or maybe they're concerned about staining, tooth stain, bad breath, or sugar in sports drinks. If that's where their interest lies, lean into it. Start the conversation there. Talk about what they are interested in. You can say something like, "That's a great question about sports drinks. Did you know swishing with water after can help reduce the acidity and staining from certain foods and drinks?" You're still educating them, just in a way that aligns with what they want to know. And once they know the conversation is relevant to them, they're more likely to listen when you bring up the less exciting stuff like flossing or brushing techniques. It's all about opening the door with something that interests them and gradually guiding them toward more comprehensive care. This doesn't just build rapport, it builds motivation. And that's what gets results. We've all had it where the patient only wants to talk about teeth whitening. That's fine. Talk about teeth whitening. Get into that topic, build the motivation, and then also discuss the stuff they aren't as interested in, such as gum disease or whatever the case, and tie it back into the topic they are interested in. Once we treat this gum disease, then you will be able to get better whitening results. Number 3, use tools that help patients stay consistent at home. So finally, collaboration doesn't end in the operatory. Once they leave your op, you gotta count on them for the next 6 months to do all the correct stuff at home, right? It's about helping patients stay on track between visits, and that's where tools like toothbrushing apps come in. I've been recommending the BetterMouth app to my patients because it's totally free, super user-friendly, and it helps them build daily dental habits that actually stick. The app tracks their brushing and flossing streaks and even sends little reminders and progress updates. It's like a little hygiene coach in their pocket, available 365 days a year. And what's great is that they can come back to their next dental appointment and be like, look, I've flossed X amount of days in a row. They can show you right there on their phone. That creates a real sense of ownership and accountability, because let's be honest, we only see our patients twice or maybe a few times a year, maybe 4 if they're on perio maintenance. But what really determines their oral health outcomes is what they do at home every single day. We all know this. So I'm all about giving them the tools to help them succeed when I'm not around. Lots of people know how to brush and floss correctly, but they just struggle with consistency. So I'll link the BetterMouth app below. There's a free version. I use it. It's gamified. You win prizes when you complete monthly challenges, and I'm all about a monthly challenge. Enough about me. It's also great for patients since it makes it easier for them to actually follow through. It's a win-win. Overall, to recap our 3 tips: 1, meet your patients where they're at. Progress over perfection. 2, start with what they care about, then build from there. 3, recommend home care tools like the BetterMouth app to help them stay on track between visits. Collaboration is about connection. It's about listening, adapting, and empowering. I studied health communication for my master's degree, and everything I read, all of the literature, all the theories, they all link back to working with people instead of just instructing them. It helps them become active participants in their own health. And research shows that that's how real change happens. So let me know in the comments, what strategies have you used to connect better with your patients? Or if you try any of these, I'd love to hear how they go for you. Thanks so much for watching. Don't forget to like, subscribe, and share this video with your fellow dental pros, colleagues, and friends. And until next time, I'll see you on Instagram at Teeth Talk Girl. Peace, love, and teeth.